24. I'm not sure what the trick is here. Maybe just to trick you, since it's supposed to be a melanocytic lecture, to see if you would think this is melanocytic. But yeah, little nested here. Yeah, sure. Because I mean, epithelial things nest too, so that's fine. Yeah, that's exactly what I would call it, Kayla. I'd call it squamous cell carcinoma, and kind of uglier, I would probably call it moderate. Differentiation is somewhat in the eye of the beholder. Elsewhere in pathology, people might still call this well diff because it's obviously making keratin, but I would call it invasive squamous cell and probably say moderately differentiated, but I think there's some subjectivity there. Yeah, I think it's fair though to recognize squamous cell carcinoma seems easy, but I certainly have times, especially if you had a small sample, where you might struggle. And I have seen actual cases of melanoma that got misdiagnosed as squamous cell carcinoma, and stains weren't done. So it seems like simple, but we can all make mistakes, and especially when we have a small sample or don't have a good clinical context, or if the cytoplasm is not quite as pink and looks a little more gray, you could have trouble. If you have any doubt, we can easily do stains to sort these out. CK56 or P40 would stain squame, and S100 SOX MART would stain melanoma.